Hi, I'd like to talk about torticollis. Torticollis is when the muscle, primarily on one side of the neck, is shortened or overcontracted. We call that spasm. Usually, most of the time, the person will awaken with this particular condition. Generally, they may be sleeping on a pillow that's too low or too high. They may notice that they're sleeping on their stomach and they awake with this acute spasm of the muscle. Now, the cardinal sign for torticollis is contracture, usually on one side of the neck, pulling the head to one side. The upper trap can be pulled, making you feel like you can't turn to one side, but the other side is obviously easier to turn. Usually the side that the contracture is on, the side you look towards, that same contracted side will usually be very painful. Again, looking at your low pillows, your high pillows, sleeping on your stomach with your head turned to the side. Generally, you're irritating nerves. Those nerves go down the arm into the hand, down the shoulder blade, can cause headaches, over the head behind the skull, off to the temporal area of the mastoid process where the SCM muscle, the sternocleidomastoid muscle, is attaching. The body is overcompensating. It's protecting the area, although even though the nerve may not be compressed, but the nerve can be irritated. But in order to break this reflex, there is a great little technique called PNF, proprioceptive neuromuscular facilitation, a long name, but it's a proprioceptive type of exercise or technique that you can do to help break that spasm. So if the spasm is on the left side, you're going to go ahead and you're going to pull it to the right and you're going to stretch that left side. Now here's the key. Now once you're pulling it, you want to go ahead and push your head against your hand. Keep resisting against your hand for about 7 to 10 seconds. Okay? And then what you want to do is relax it. Then you're going to pull a little bit more over. Then you're going to push against your hand. Okay? 7, 10 seconds. Then you're going to pull more over. Now by doing this, wherever the side is contracted, you're going to pull away from that muscle. So if it's contracted in the back part of your, the left back part, you're going to pull forward and away to the right. If it's just on the left, you're going to pull over to the right. But when you pull over, you want to resist 7 to 10 seconds and relax, then pull over more to where you can't pull anymore and keep resisting at 7 to 10 seconds. You'll do about maybe 3 or 4 resistive exercises per full technique. So when you do this type of exercise, in order to complete the whole cycle, you want to take it to the fullest and farthest range of motion you can get it to where you can't go anymore. By doing that technique, you're resetting those muscle spindles for the brain and those joints to communicate, kind of like you're rebooting a computer so things can start fresh again. I hope that makes a big change for you. Make it a great day. I'm Dr. Alan Mandell.